So again, we're going to have a look at some hip strengthening work here. So just following on from the bridge with hip shift that we did. So this is really about creating sensation in this sort of glute med area. So now instead of having the leg bent, we've got the leg straight. So imagine this is Mariela standing on this leg, and that's the other leg swinging forward, okay, for walking. So we want to make sure we've got a little bit of space underneath the waist here, and she's going to achieve that by sending her leg along the foam roller a bit and just toning up these oblique abdominals. Then she's going to lift from her heel to her hip in one piece so that the foot is totally parallel, and we're just contracting the muscle up here between that greater trochanter and the top of the hip bone, or the ilium bone, to come down. So she's going to exhale, find the length, and then just the lift. So it's not about getting the leg high, it's just about creating sensation in here. And we want to make sure that the heel is directly underneath the sitting bone. Some people really dominant in the front, so they tend to pull the leg forward and use the quad and the TFL more than the glute med. So we just want to create that sensation so that when she stands up and transfers her weight, that the muscles are there to hold her. So we want to have this beautiful side body all activated, okay? When we're walking, the pelvis moves over the leg doesn't move towards the pelvis. So, this is really just about creating some sensation in there. So we do whatever number we need to do there. This is also fantastic for anybody that's had hip replacement surgery, to sort of start strengthening the muscles that have probably been cut through and that would have weakened as a result of the hip deteriorating. So we would do that on both sides. So once you've done whatever you need to do on this side, you do whatever you need to do on the other.